Good evening, everybody, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here tonight virtually with Dr. Sharafi. He's out in San Diego, and I'm here in the Lakeland office. And we are going to be talking all things dental implants. So thank you so much for joining us. We're excited to have you, and we can't wait to answer your questions. So you're joining us through YouTube. It's really simple. You can just type your questions into the chat box, and we will be able to see those and answer those for you tonight. So send all the questions, and we're excited to get started. How are you doing tonight, Dr. Sharafi?
Doing fantastic. Thank you so much. How are you doing?
Very, very good. And so we'll go ahead and just jump right into it. I'll talk a little bit about Dr. Sharafi. So he is a board-certified oral and maxillofacial surgeon that graduated from University of Maryland Dental School and trained extensively in dental implant surgery, orthodontic surgery, maxillofacial trauma surgery, and facial cosmetic surgery. He is also one of the few oral surgeons in California that holds the California Cosmetic Surgery License and has a huge passion for the New Teeth Now procedure and full arch implants, and has placed over 3,500 arches in his career, which is huge, especially because you want a surgeon who does this type of procedure every day to be operating on you as well. So Dr. Sharafi, can you tell us a little bit about why it's so important to be board certified?
Yeah, absolutely. Obviously, oral maxillofacial surgeons have extensive training through residency to do some complicated cases. We deal with a lot of trauma cases. We're very familiar with the facial structure, of course, doing 4 to 6 years of residency. And more importantly, after residency, we go through a rigorous board certification, of course, with written and oral examinations to be certified as a board certified oral surgeon and to be able to do these heavy duty, extensive cases that come along to our offices. Yeah.
Yes, it's so important. And while we're on this topic, just kind of talking about the differences between an oral surgeon versus like a general dentist who may only do this a couple times a month. Why is that such a huge difference?
Yeah, I mean, obviously, everybody goes through the rigorous training in dental school, and after dental school, a lot of obviously our general dentist friends are able to practice as doing general dentistry work. Oral surgeons, of course, through that extensive extra 4 to 6 years of residency for more complicated, everything from cancer to cosmetic surgery to dental implants to get more training. We have a lot of good general dentists out there that do some of these more basic surgeries, implant surgeries out there, but we are more trained, obviously, to do more the complicated zygomatic implants, deal with complications, which really comes along in a lot of these extensive cases. So yes, some people out there who I've taught myself through some of the courses I teach in full arch, do some cases in their office that are more simple. Most of the cases are handled by board certified oral surgeons who are doing more extensive one of these. And I have to say, there's a lot of oral surgeons out there that don't do a lot of these cases. So it's also important to find out that this specific immediate loading teeth in a day, did what we do at New Teeth Now, who has out there done more of these? It's very important for patients to ask doctors, how many arches have you done, or have you done them, or are you capable of handling some of the complications that come with this specific procedure? Every procedure has its different things. Some people are very good in cosmetic surgery or cancer surgery. This specific procedure, I always tell patients, you sometimes only get one chance at it. So if it's not done perfectly from the beginning, then you really have no choice down the line to fix the problem and have teeth. So that's really important.
That's a really important point. Can you talk a little bit about like any failed cases? Do you see that a lot? Do people come to you that need their implants fixed?
You touched on a very interesting topic here. I feel like in San Diego, and I'm sure my partners in Florida, we have become the center that deals with all the failed cases that come all of through Southern California. In fact, I had a case from Las Vegas the other day. I had a case from San Francisco the other day. I myself and my partners, Dr. Evans, Dr. Zan, the Vakili, we deal with a lot of failed cases that walk into our office. And one of the issues at hand is that a lot of people think that they can do these cases and then they do it. But once it becomes a problem and implants fail and not go well, then they don't know what to do. And that's when they come to our offices. And in fact, we have oral surgeons in town, periodontists in town, general dentists in town that specifically refer to us only for failed cases.
And we'll kind of talk about how the office operates. So it is all in one day. The procedure takes place in a single day, and our surgeons, our dental lab, and restorative doctors all work in tandem together for the outcome of the patient. And so we really see just a bigger difference in communication and just the outcomes when, you know, New Teeth Now is under one roof and we're all working as a team for the final goal, versus a patient having to go to a bunch of different companies to get the final result. But we see patients from all over. All 50 states have come and had New Teeth Now done, and we try to make that process, you know, very convenient. Can you kind of touch on, you were just talking about how you had a couple of cases from like Las Vegas and San Francisco. How does that process work for someone coming out of state?
Yeah, that's very important because obviously our administrators and our treatment plan coordinators sometimes discuss some of these cases over the phone via Zoom with some patients and kind of go over, like, you know, what problems they have. They sometimes send us extra to initially kind of evaluate, you know, what's going on. And yeah, we patients fly to us. The thing that you touched on, the fact that we have a full dental lab in our facility allows us to have a patient fly in from somewhere else and be able to work up their case the same day, take impressions, scan them, whatever is necessary to get their teeth dirty, and even maybe the next day or 2 days later have the surgery done, because, you know, we have our anesthesiologists who come to our office, of course, in-house anesthesia, who we have several times a week. So we're ready to go to get these cases done. And, you know, we have them maybe spend a couple of days afterwards at one of our local hotels, or family members if they have in town, and check up on them, make sure everything's going well. And then, yes, they can then go back to their residences, and then, of course, follow-ups and coming back and things like that. So easily coordinated, no big deal there.
That's perfect. And we can also touch on some of the key differentiators that really sets us apart from other facilities. So we did already talk about the board certified oral surgeons, but can you kind of dive in more for, you know, the zygomatic implants and general anesthesia, and why that's such a huge deal to offer?
Absolutely. This is a big topic for us. Obviously, at our office and our Florida offices, of course, all of the doctors are fully trained in zygomatic implants and pterygoid implants specifically. My partners, Dr. Evans, Dr. Zan Vakili, also. And this is really critical because this procedure, where basically zygomatic implants are for the upper jaw and for patients who don't have bone or you know, have loss in indentures, we are able to tackle any upper jaw surgery by using zygomatic implants, which are, we call, you know, cheekbone implants. There is only, I would say, less than 1% of dentists, oral surgeons even included in that, in the country, that are able to place these kind of implants. They're very complicated. It is not something to mess around with. You want the doctor to have very good experience in this. And literally, we're able to give these patients who are in indentures, who have been in indentures for maybe 20, 30 years. They have been told they have no bone, never going to have teeth, fixed teeth in their mouth, and they walk out the same day with teeth. I mean, I get such a satisfaction out of those kind of days. I can't even tell you. One of my passions. So it's very critical to know that we are trained in that. I teach a course in zygomatic implants to other doctors around the country. So it's very critical that, you know, to understand that. We also, as you showed on the slide, we truly believe that this procedure should be done under general anesthesia, so the patient is sleep comfortable, someone is monitoring them. for safety reasons. I know so many places that do these cases under local anesthesia,
Wow.
IV sedation, twilight sleep.
Wow. Yeah.
And to me, honestly, that's nonsense. And no patient should go. I always tell my patients, would you take your appendix out with twilight sleep? That's not
Yeah.
something that's safe or either relevant. So those are big components. If you're going somewhere else, to ask. But that's what we do, of course, at our centers. Yeah.
That's excellent points. And the general anesthesia is also included in our fees, which is also huge. So we'll kind of go into the anatomy of things. So when we're looking at this fixed upper hybrid here, what is our audience seeing with the upper
The
jaw?
main thing here to understand is that, and of course, we always tell the patients this too. I always tell them when I talk to them that we will place as many implants in the upper and the lower jaw necessary to get the job done. So if someone requires 4 implants to get the job done, great. If it requires 5, 6, I don't know, 7 sometimes implants to get the job, our goal is to place as many implants in good bone, in good structure, to be able to deliver it to you molar to molar teeth, screwed in, non-removable, of course. And the beauty of these teeth are designed at our centers by our local lab technicians is that they're, before even the surgery, you have determined the color, the shade, what needs to go in your mouth. We prepare it beforehand. And what you're seeing here is a set of teeth that has basically pink gums. The junction of your own gums and the pink gums that are on the teeth are well hidden below your lips. So it's very aesthetic. It looks very beautiful, even in the temporary phase, because initially you get a set of temporary teeth. And the beautiful thing about the temporary set is that it allows some couple of months of the patient, I tell the patient, hey, wear this, have your family members make comments, show it to your friends, what do you like, what do you not like about it, kind of get a feel of, what it is that makes them beautiful and functions well. And then when we make your final set in zirconia, usually, which is a very strong set of teeth, then they give us feedback. Hey, make it lighter for me. Or, I want my front tooth rotated a little bit. It's very customized to everything that you want. I had a patient the other day who wanted me to put a diamond on their lateral incisor. And we work that in, it's you and what you deserve to have in your mouth. So that's kind of what you're seeing in there.
Yeah, it is awesome how fully customizable they are, and they'll feel like your teeth by the end of the whole procedure or process.
Absolutely.
And then this is the lower hybrid, and it's very similar. This one is showing 6 implants for that. And then concept. We move on to the zygomatic implants. So here's a quick animation about what those zygomatic implants look like.
Yes. Exactly what I was explaining to you. We use the cheekbone, which is a very good area of very good structural bone in that area for patients who don't have any bone in that area of the mouth. So these are longer implants. The patient has no sense that these implants are even in there. They don't feel any different to the patient from any regular implants. And we're able to bypass the sinuses and prevent any major grafting in the sinus, basically. And we're able to, again, place this the same day and be able to put the teeth on it the same day. They're very strong implants, very successful, minimal post-operative, discomfort or swelling, nothing different than any other implant that we're doing. But I have to say, as you can see, that implant is long, it's very close to the eye, for example. You have to know, and you have to have someone who knows what they're doing place those implants. That is the critical aspect of this treatment and this option available out there.
Yes, definitely. And your office is one of the only zygomatic centers in Southern California, so that's very important if a patient has bone loss to go to a place that does this all the time. That's super critical. And have you ever had any cases where you had to turn someone away because of bone loss?
To be honest, since myself and my fellow doctors that work at New Teeth now, we're so able to place these extensive and I call them, crazy implants. It's not so much that we can't place the implants. It's more important for some reason or another you can't have this case done because of more of a medical problem, or
Right.
you have an uncontrolled diabetes or something like that. And the beautiful thing about dealing with oral surgeons is that we've gone through a rigorous medical training, general surgery, all those things, and that allows us to understand the patient's medical problem. If you have osteoporosis, we know how to deal with your medications. If you have diabetes, we know how to deal and talk to your medical doctor about it. So those are the things that sometimes keep patients back, not so much a surgical portion of it. We're able to handle the case. It's just we have to make sure you're optimized for the surgery. So we talk to your doctors, we send letters to your doctors, make sure that if you do have some of those medical problems, to be on top of it. And that's very critical. That's very important. Patient
Yes.
safety, of course, comes first.
Definitely. And this is just a scan of what the zygomas would look like. So you saw the animation. This is a real x-ray with 2 zygomas. And then we have the quad zygomatic implants. So why would someone need 4 zygomatic implants?
Yeah, quad zygomas, you're now a step above the more difficult regular zygomatics, and I would say not too many people do these at all. I personally, this is my passion. And quad zygomas for patients who really have 0 bone. As you saw in that previous x-ray, we were able to put 2 zygoma implants, and at least in the front area, the patient has some bone. So we're able to utilize that bone in the front to get a couple of implants there, 2 to 4, whatever is necessary. And in the back, for support of the molars, we put the zygomatic. If the patient does not have any of that bone in the front, there's nowhere to place the bone. There's no way to grow that bone back. And in this scenario, we put 2 zygomatic implants on each side. And that allows us to have 4 anchors to hang and secure your teeth on top of those. And this opens up a separate entity for patients who are really, really lacking bone and have been told by everybody that they cannot have teeth. So this is very critical, important treatment to have in our practice there.
Yes. So if you ever have been told that you don't have enough bone for implants and that you can never get implants, you might just need quad zygomatic implants. So definitely reach out to us and book a call or a consultation. Come see us, and we will determine if that's possible. And so we are going to hear from one of our patients. And this, honestly, I feel like is the best way to get to know how this process is and how transformative it is for our patients, is to hear from one, and how, for Tommy, how his life changed dramatically after this procedure. So we're going to hear from Tommy now.
My name is Tommy, and I'm a real patient for new teeth now. And every time you go to the dentist, it costs a lot of money. You could save money and you do it one time and you're done. No more bleeding, no more bridges, nothing. I don't even feel the difference, and it's natural. I eat crawfish, I eat crab, I eat everything. My wife at first and some of her friends, they think maybe it's not a good idea. But now, after I've done it, they see it, and I'm like it.
New Teeth Now is a one-of-a-kind restorative dental procedure that has given thousands of people their smile back. For our patients, New Teeth Now is a lifetime solution after years of suffering. And we can help you too in just one day.
Thanks to New Teeth Now, I love my smile. I don't even feel the difference, and it's natural. And I'm always smiling, and I love it. The proof is right here.
Call us today, and let's get your smile back.
So yeah, you can just tell in the after photo how much more animated he is, and he's such a happy guy and had an incredible transformation with the procedure. So that's awesome. And let's kind of go over what candidacy looks like. So if you have no teeth, are unhappy with your dentures, if you have a mouthful of bad teeth, have severe periodontal disease, or have ever been told that you don't have enough bone for implants, you are most likely a candidate. Dr. Sharafi, is there any other factors that are good that determine that someone's a candidate?
What you have listed there is kind of covers most of the patients. I think one thing is that a lot of patients who are seeing their general dentist or periodontist or different things, and have extensive like periodontal disease, you get into this bad cycle of continuously going there every 2 months, every 3 months, and nothing is improving. And, you get to a point where your body is fighting this so much. So they're never told that there's this option available. So if you're out there and you're going through that process and you haven't been told that option as a possibility, this is when you want to come see us and discuss that option available to you. So I just wanted to throw that out there that you're not always told about it. So you need to kind of do a little bit of your own research and seek us out.
Yeah, that's a great point. So many of our patients really talk about like they were just struggling trying to like keep their teeth going for years, and they just wish they had done this sooner and just not had to deal with the money and the time that was involved in just maintaining the little teeth that they had left or their periodontal disease and all of that. That's a great point. And then to highlight our key differentiators again, these are definitely things you want to bring to any consultation or any research you're doing to see if you have board certified oral surgeons, if you have capability of zygomatic implants and general anesthesia. And then our implant coordinator in San Diego is Diana. Can you kind of tell the audience, what the consultation would look like if they came in and saw you?
Absolutely. Very straightforward. So obviously we're going to be seeing you at no charge, of course, getting a CT scan at our own office. You will sit down with Diana and tell your story a little bit and tell us what's going on. Obviously, you'll talk with one of our doctors, myself, Dr. Evans, Dr. Zanavivakili, in our office specifically. And we will go over your x-ray, talk about the different options that are available to you, and how good of a candidate you are, medical history. And if you're a good candidate, of course, we'll let you know at that moment. And then the most important thing is to have Diana, who is amazing, come in the room and further discuss, like you mentioned, the financial aspect, because it's important. It's like, I tell people, I hate to relate this to like buying a car almost. When I go buy a car, we have to figure out the financing before I walk off the lot with the car. In this situation, same thing. We have so many different options available to you from a financing standpoint and how to pay for this procedure, which makes us very different from other people, of course, because that's a big portion for our patients. We don't want to underestimate that part of it. So we make you comfortable with the payments, and then she will coordinate everything from, if you need medical clearances with your doctor, when to come in for your workup date before the surgery, when is your surgery date, what time, then we, prescription, all those things that come. We're just like a machine in our office. We have it all set up for you. And that's what I hear most is when patients come and go through the process, and, man, you guys got everything together. We didn't see this anywhere else. And through the procedure, through the follow-ups, what days to come in, when to see our lab technician, all those things that come with it. So we'll walk you through all the steps, of course, and it's nice to have a coordinator where you can contact, you can message her, you can text her, you can cell phone, call her on the cell phone anytime, and she will answer all your questions, of course. So
yeah, it's excellent to have someone that you can go to, and it's like a family. You're not just like pushed in and out of the door. Like you're there for a while, and you get to know everybody, and it's really, really great.
We're almost like a I want to say a mom and pop shop almost, because.
Yeah.
I've worked myself back in the days at these big centers where, that's out there. You get lost in those kind of places. There's no follow-up. There's no, I've been through it. Otherwise, I would have stayed there myself, right? But we took all of that and brought it and incorporated in our new teeth now centers, and put the best together for our patients so they feel at home. Everyone that comes in there says, feels like a family here. We see the same faces over and over again. So that's the beautiful thing.
And this is your team.
Yes.
So do you want to highlight the members of your staff or like the different departments or anything like that?
No, of course. So obviously you see myself over there on the left side. Next to me is Rigo, who is a lab technician I've been working with for the past 4 or 5 years. He is amazing. Everybody loves him. His work is great. He will, sit with you, work out whatever you need. The two gentlemen in the back, they're my two partners, Dr. Evans and Dr. Zindavikili, both board-certified oral maxillofacial surgeons. Dr. Evans is a retired military oral surgeon, so he has great ties to the Navy and the Veterans Hospital, and both of them also have relationship with the hospitals in town, especially Rady's Hospital, which is a children's hospital in town. And Diana, you see in the front and center. Next to Diana, we have our another treatment plan coordinator, Letty, and then just, our front staff and our back assistants and nurses that we have in the office to help you through the process there.
Awesome. And from the team, we will talk about how the process actually works. So I'll kind of run through this, and then you can add on to anything you'd like. But yes. Generally, if someone comes in for a consultation and they're like, all right, sign me up, let's schedule surgery. So the next step would be to come in for a pre-op and impressions appointment before surgery, which is where you would have those impressions taken and pick out what your temporary teeth would look like. And then you'll have a day of surgery, so that's a 1-day procedure. You leave with your new set of teeth. And then there's a series of post-op and adjustment appointments while your implants are fusing with the bone and healing, your gums are healing, all of that. And then around the 6-month mark, however long it takes to heal, depending on your case, we will start the process of creating and placing the final zirconia teeth. And then from there, there's just simple care and maintenance, which is brushing, water flossing, and then coming in once or twice a year to get your teeth cleaned. So yeah, that was a lot, but it's in the simplified way. And Dr. Sharafi, feel free to touch on any of that I just talked about.
Well, that was very accurate. I'd like to make a point of the fact that after your final teeth are in, my big thing, and all of us have new teeth now, in fact, the care and the maintenance afterwards. This is where we differentiate ourselves a lot. And of course, the surgery and the difficult cases and all that. But this is where we differentiate ourselves to a point where we continue to monitor you after the final teeth are in. This is something that I'm telling you as a fact, you're not going to get at most of the big centers out there. You're lost. You have patients coming back 7, 8 years later with teeth in their hands that failed. They said, what happened? There was no follow-up at the other places. You have to have follow-up. We have to show you how to continue cleaning these. We have to catch problems early to fix them for you. So those are important factors for patients,
Yeah, that's extremely important. And what about the offices that they say, oh, you'll get your teeth in 24 hours, and then we don't have to really see you anymore? What's the red flag there?
This is the new thing. Don't get me started on this. Something that I just want to say, we do things on a very scientific basis. These are well-studied cases. What we do is based on scientific data that has been studied over years. Getting your final set of teeth, rigid teeth in zirconia or other material 24 hours after surgery is a gimmick that is out there. I'm going to tell you right now, and that is not supported by studies. And in fact, you don't want that. You don't want me to deliver your teeth 24 hours later, your final teeth. Of course, you're going to have teeth, they're temporaries. You don't want your final teeth 24 hours later, and then I say, see you later. Good luck with everything. Hope everything goes well. I see you when I see you. This is a gimmick. This is unfortunately going to come back and haunt a lot of patients and doctors, because these are the kind of cases that are going to fail. These are the cases that are not going to do well. And these are the cases that later come back to us and we have to fix. So I highly recommend to patients that if you're going to centers that are telling you you're going to get your final teeth 24 hours later, and those are your final teeth, please do yourself a favor, get up and leave and come see us. I'm telling you as a friend that this is not something that is appropriate in our specialty in dentistry at the moment. I will stand by that.
Yeah, that's excellent. Really, really important to know. All right, so, well, we kind of talked about a consultation already, but at the consultation, it includes a CT scan and the development of a treatment plan with exact fees. So when you leave the office, you're going to know exactly what would happen and the price for your specific case. And then we are going to hear from one more patient. His name is Robert. And you'll also see that incredible transformation after having new teeth now.
Having new teeth now is a revelation, to be quite honest with you, from where it was to where I am now. And some of my friends actually couldn't believe the difference. The health issues I had have gone, and I feel a lot better in myself than I've ever done for many years. I mean, it was incredible. My teeth look natural. I mean, it's not like having false teeth where you have to take them out at night. They're permanent, they're there 365 days of the year.
Our daily mission at New Teeth Now is to help patients overcome the challenges of severe long-term dental problems. We've helped thousands of patients regain their health, happiness, and confidence. And we can help you too in just one day.
I have no worries about smiling, talking, eating, my smile, my outlook on life. How you feel after you've had your teeth done is incredible. New Teeth Now, it's the only way to go.
So I love that video of Robert, and I actually thought he brought up a good point that we could talk about, was that he didn't have dentures, so it wasn't something that he had to like take in and out. Can you kind of explain the benefits of having something that's fixed and non-removable versus a denture?
Yeah, I mean, dentures are a thing of the past, right? I mean, I don't even think most dental schools in the country are teaching dentures anymore. And the most important thing is that a denture is the old-fashioned way of replacing somebody who doesn't have teeth or getting their teeth extracted. It's a big piece of plastic that covers the roof of your mouth. Most patients are gagging on it, of course, because it's so far back. You have to take it out a couple times a day or every day and clean it, and you have to use a glue, especially the lower. The lower is a nightmare. Most patients, I don't think, even wear their lower dentures. They are gluing it in with the Fixodent material. Same thing goes in for what they call the snap-on denture, where two implants are placed and the thing tries to snap on. Even though it's an option, it's still a denture. I always tell the patient a denture is still a denture when it's a denture. So these are removable devices that you don't feel confident about, right? You're moving along, you're talking to people, you're at a wedding, you're worried about this thing popping out of your mouth, moving, and like the old advertisement, kids getting scared their grandma's teeth are popping out of their mouth. The beauty of this is the confidence of having fixed, screwed-in teeth that doesn't cover your palate. You can taste. You're not using glue. This is fixed. The only person that can remove this is me at the office. And you have that confidence, that self-confidence from the minute that you have this in your mouth, the day of the surgery, going forward. And that's what's most important. That's what is a game changer in dentistry, being able to do that. Back in the days, we used to take out patients' teeth, maybe put in implants the same day, but then put you in a denture. And then 6 months later, you would come in and we would put teeth on it. This is what's the difference, is that the fact the same day we're doing this. Well studied, well published, going back 20 years, 15 years studies, showing this to be a successful case. As you mentioned, we've done so many of these arches, 3,000-4,000 of them myself included. I've been doing this since 2009, and very successful. I wouldn't do this if this was not a successful case, of course.
But I was gonna talk more about dentures and like the long-term health of like dental implants. So like how long, if someone gets full set of dental implants, how long will that last them?
Yeah, very good question. Before I even mention that, let's talk about the fact that when you wear a denture, you notice when patients wear denture, every couple of years the denture has to be changed or doesn't fit very well. Why doesn't it fit you all of a sudden? Because you continue to lose bone under the denture. So this denture sits on your gums, rubs on your gums, allows that bone to dissolve under your gums. So you get that sunken feeling of your face when you remove the denture. The beautiful thing about implants is that they maintain the level of bone in your jawbone. So the bone does not dissolve in a way. The brain sees that as like having teeth in your jawbone and doesn't allow the bone to degenerate around your jaw. So that's the beauty thing of having implants. How long do implants last? Well, you know, I always tell patients, my goal is to have these implants in your mouth for the rest of your life. Implants only been studied scientifically for, you know, 30, 40 years, let's say. So we don't know the long-term 50 years, 60 years, 70 years down the line, but the goal is to maintain these properly, to maintain well. If you, for example, if you're diabetic and you're maintaining your diabetes is under control, there's no reason why you shouldn't have these implants for the rest of your life, for the next 30 years, for the next 40 years. There's no reason for that. The beautiful thing about this procedure that we do is that the teeth itself, let's say 10 years from now, you say to yourself, you know, I want a little darker shade of teeth, or I want the super white teeth, or whatever the case might be. You can change the teeth. You know, the implants are still there. The implants are successful. They're healed. They're well integrated. You just change the teeth, and that's another beautiful thing. I tell patients, you don't like it, you know, in 5 years, you want to change the shade, the color, the design of them. You change your mind. You change your hair color. You want your teeth to be different. You can change it. So that's the nice thing about this procedure and the way it works.
Yes, definitely. And we did have a question come in. Is there a great amount of pain after the surgery?
Very good question. So again, I'm telling you from what I'm seeing from patients. This is, you can ask, you can call our patients, you can talk to them. This procedure, first of all, all of our surgeons at New Teeth Now, we're super efficient at the surgery. So we're not spending 6-7 hours in your mouth doing a surgery. Quickly done, properly done, sutured together. Since we suture everything together with dissolvable sutures usually afterwards, there's no chance of getting dry sockets and things like that sometimes you hear are painful to patients. Secondarily, most patients are very sore afterwards. They're not in pain necessarily, like a tooth pain that you sometimes have. You're sore, and obviously we're giving you medication afterwards, anti-inflammatory medication, not only through the IV during the surgery, but afterwards to take the inflammation. Now we'll go over how to ice your face. We go over how to rinse your mouth and all those instructions necessary to keep the swelling and the bruising down. But we don't, you know, I don't hide anything from patients. I tell them, look, for several days, you're going to be swollen. You may get a little bruised. This is a big procedure. Plan ahead for it. We're here for you if you need us for any recommendations or see you. But it's not so much pain. You're just sore. You're sore for several days, as expected. You know, it's a big procedure, of course. It's so, you know, we're not trying to undermine what we're doing here. But we have the proper medications and instructions for you to recover fully. And you'd be surprised. Some patients come in, I'm like, you know, how did it go the first 2 weeks for you? And they, you know, they say, oh, it went great. You know, I did fine. There wasn't that much. You made it sound like it's going to be so bad, but I did great. So I think it's more just following the instructions and what we tell you and what you're doing afterwards, and the recovery is pretty smooth.
But Dr. Sharafi, is there anything else you want to add as we wrap this up?
I think my main thing is that obviously, you know, you type this type of procedure on the internet, so many different things pop up, right? Do your homework, know who you're going to. If you're going somewhere and they say they do surgery, are they surgeons? You know, it's like going somewhere and trying to get a facelift and the person is doing it is not a plastic surgeon. You have to have the right people do this procedure for you with the right post-operative care. And I always tell the patients, you can be confident that we know how to deal with complications, right? If your doctor does not know how to deal with complications, you shouldn't be going there and getting a procedure done. It's very simple. So those are the things I want you guys to keep in mind as you're seeing some of the advertisements and different things that are on TV and radio and internet. There's a lot of them out there. But pick the right people to do the procedure. You only have one shot at this surgery.
Yeah, that's so important. And we do recommend like having several consults, like calling different people, asking those questions so that you feel confident in your decision. You know, the knowledge is power, so definitely use that to your advantage. And we just thank you for taking the time to join us tonight, and we hope everyone has a wonderful evening.